Hi, I'm Kim. I'm one of the educators at Blossom Antenatal, and I'm going to have a chat to you about engorgement, or rather avoiding engorgement. Engorgement is when the breasts become really, really full, and so full that they're shiny and hard, and the milk can't drain well through your breasts. So what happens is when you've delivered your baby, the placenta will be delivered, and with the placenta being delivered, there'll be a release, like we call it releasing the handbrake on all those hormones that are waiting to make milk, and they will increase. So prolactin and oxytocin increases quite rapidly once that placenta is delivered, and all those lovely hormones start making milk. And they need to keep being stimulated by your baby feeding frequently. So when your baby's first born on that first day, they might only have 1 or 2 feeds, and that's okay. There's a lot of learning that's going on. But as they start to wake up and start to get hungry, they'll feed quite frequently. And we want that. We want your baby to feed frequently and stimulate those hormones, bringing that milk in. So as also with the prolactin and oxytocin is another hormone, which is the feedback inhibitor of lactation, or FIL. And FIL comes along and sort of regulates if there's too much milk. So we don't want too much feedback inhibitor of lactation, otherwise it's going to trigger that milk production right down. And FIL, the feedback inhibitor of lactation, really increases when breasts are really full. So if your breasts are really, really firm and full, there'll be a lot of FIL released. So we want to sort of try and regulate that. So what's happening is you're feeding your baby quite frequently, because that's what we know they want to do. And they often peak around that day 3. And then there's a hormonal shift, of course, and on day 4 or 5, you might get, very hormonal, and your breasts are starting to get quite heavy and full. So it's okay that they're heavy and full. That's normal to feel a bit of warmness and heaviness in your breast. And your baby might change their feeding patterns. So they were feeding quite frequently side to side, and then suddenly they're feeding on one breast and they're not wanting to go on the other side. And that's okay. So it's much more important to soften that first breast. Baby might have even 2 goes on that first breast to just make it a bit lighter. It won't be completely drained at this stage, but it'll feel lighter and those lumpiness will sort of settle down. And then baby might not want the other side, and that's okay. So it's important not to do timing and like 10 minutes on each side. That'll cause more problems. So because breastfeeding is so individual, it might work for one mum, but it really doesn't work for the majority. So we need to feed baby to their need. And some babies are very ravenous and they'll feed quite quickly, whereas other babies need, 40 minutes to completely sort of drain or finish one breast. So what's going to happen to that other breast, because that's going to be feeling really quite full? What you can do is you can put some cool packs on your breast. So I've got a bit of a breast here to show you. And so you might find if you've got prepared some commercial pack like this that sits nicely around your breast, that's lovely. You can hold that on for 15-20 minutes, because breasts are really hot and full, and it's like if you have injured your knee or something like that and it's full and it's inflamed, cool pack will help to settle it down. So you could use that on that other side. The other thing that we used quite often was cabbage leaves. So I've got a little bit of cabbage here to show you. So you'd place it around your breast, and you wouldn't put it on your nipple because it makes it a bit soggy. And you wouldn't use red cabbage that I've got here, and it's just happened to be what I had in my fridge. But it probably would work, but it might leave a bit of stain on your breasts or on your bra. So better to use the green cabbage, and I've heard that Savoy cabbage is better because it's got that wrinkliness to it. So it sort of, I don't know, it works better. But any cabbage will do. And the advantage with cabbage is you can put it around your breast. You can even make a little poultice if you've got a hard lump. can put it around your breast, and you can put your bra on, or, you know, a tight t-shirt top, because you don't want too much tightness around your breast. And then you can rest. So rest is really important too in managing any breastfeeding issues. And you don't have to worry about it then. You'll find the cabbage is almost cooked and all soggy when you wake up. But with a cool pat, you will have to hold it and sit up and hold it for 10 to 20 minutes or so, whatever you feel comfortable with, to reduce that inflammation. So cool. Your breasts are already hot. You don't really need to put any warm pack on them, although warmth can help that oxytocin release. So you might find that some warm will just help that milk flow, and then you'll put cold on afterwards. If you're finding that the milk's not flowing, you might even hop in the shower, and that might help that milk start to drip and flow. Or you could even hop in the bath, or you could put your breast in a bowl of warm water if that's comfortable. So warmth will trigger that letdown, the oxytocin release, but cool will help those breasts settle down. So it's really more the cool afterwards to help those breasts not become too inflamed. And the other thing that can happen with engorgement is that your nipple can start to get so swollen. So around the nipple is the areola, and sometimes there's so much oedema, we call it, a lot of fluid in your breast. It's not always milk that makes the engorgement, it can be fluid. And there's so much there that your nipple almost becomes really flat, and baby can't actually latch very well because your nipple's so flat and hard. I can pull that nipple in a bit there. And what happens with that is suddenly baby was latching well, and now it's also hard around your nipple that baby can't even latch to make a nice latch and drain the breast. So you might need to hand express, and we talked a little bit about hand express in the classes. So you might need to hand express a little bit out first just to soften so baby can get on. You might find using a pump draws too much fluid. There's these Hucker pumps that can be really handy for just releasing milk. And you might find just putting on that, and you just give them a little squeeze, and sometimes the milk just drips without pulling on the breast. So you might find having a little Hucker pump is a handy tool to have as well. The other thing is sometimes it's not milk that we need to get out, it's the fluid that's sitting behind the nipple. So you can do what we call reverse pressure drainage, or softening, reverse pressure softening, where we push some of that fluid the other way, and it actually goes out through the lymphatic system, out through under your arm. And you might need to lean back, or you might need to even lie down to be able to do this. And when you do that, you'll find that your nipple will come out, and then your baby will be able to latch. So expressing when you're engorged doesn't tend to work as well as getting your baby on. So feeding your baby on one side, letting it soften, having a feel, checking your breasts, thinking, oh, it still actually feels quite full. I might change baby's nappy. I might put them back on this side. And then baby's going to be so full with all your lovely milk that they're not going to want the other side. So this side, we might put a cool pack on, or we might put some cabbage on, and then we're going to have a rest, and we're going to have a nice looking after ourselves with some nice soup and being cared for and resting. Resting is really important after you've had your baby. So it's important if you do see any redness, or you start to become, so it's normal to have a little bit of a fever, but if you start to become really unwell with the chills, with a fever, and your breasts start to become very red, you need to go and see your GP, because you might be heading towards mastitis. The other thing is that some babies might be a little bit young, a little bit born early, a little bit jaundiced, and they might not wake enough. So you might have to wake them. Most babies are quite hungry and wakeful around this time, but some babies get what we call jaundice, and it peaks around day 4. And so sleepy babies can be tricky because we've got to sort of go against the natural way of wanting to let a baby rest when they're resting, and we've got to wake them. And sometimes we do need to use the pump to help when we've got a sleepy baby. So the important thing to think about with managing engorgement is that it is a hormonal response for the milk coming in, and it won't last for a long time. It's only usually in that first week or 2. It might occur later on, but it's not like that early engorgement with that huge hormonal push. So it's going to be short term. It's important to manage it by feeding your baby to their needs, which should be quite frequently, and it should be about 8 times at least in 24 hours. Babies often will feed in spurts, and then they'll have a rest and then another spurt. So it doesn't have to be regularly every 3 hours, but it needs to be, fairly frequently so that those breasts are getting movement. And then we need to feed baby mainly on one side. We can offer the other. Some babies do want dessert, but many are so full with that main meal that they don't want dessert. So on that second side, we might put some cool or cabbage leaf. We might let it drip a little bit into in the shower, or we might try a little bit of a release with a pump. We just want to take a little bit off it, and then the next time baby you'll feed on that side. Remember that there is a lot of help around that you can call. The Australian Breastfeeding Association 1-800-Mum-to-Mum number is a great one to call during this time. And also the website, they've got a great website, and also CaliMum. So the calimum.com website that we have in our presentations has really great visual information about managing engorgement, and especially on that reverse pressure movement of all that swelling that you might need to do just to be able to allow baby to remove the milk. Knowing that babies usually are the best way to drain a breast. Babies know what to do. So always trust your baby, always trust your own instincts, and remember that everyone's individual and there's always plenty of people around wanting to help.